The child Pugh score or modified child Pugh score is used to assess the prognosis of liver disease. It consists of five parameters or five clinical features. It is used to assess the prognosis of chronic liver disease and cirrhosis. The child Pugh score was originally developed in 1973 to predict surgical outcomes in patients presenting with bleeding esophageal varices. The score is used with model for end-stage liver disease or MELD score to determine the priority of liver transplantation. Now, this child Pugh score usually used to determine the prognosis as well as the required strength of treatment that can be assessed using this child Pugh score. There are five parameters for child Pugh score, that is ascites, bilirubin, encephalopathy, INR ratio, albumin. Here we are giving points, okay, 1 points, 2 points, 3 points, etc. for each parameter. So in case of ascites, if there is no ascites, the score is 1. If the presence of mild to moderate ascites, the score is 2. In case of severe ascites, the score is 3. Next parameter is bilirubin. If the bilirubin less than 2 mg per dl, the score is 1. If the bilirubin between 2 and 3, the score is 2. If it is greater than 3, the score is 3. Next one is encephalopathy. If there is no encephalopathy, the score is 1. In case of mild to moderate encephalopathy, the score is 2. In case of severe encephalopathy, the score is 3. Next parameter is INR ratio. If the INR ratio within normal limits or less than 1.7, the score is 1. If it is between 1.7 to 2.3, the score is 2. And if it is in greater than 2.3, the score is 3. Next parameter is albumin. Albumin greater than 3.5 indicates score is 1. 2.2 to 3.5, the score is 2. If it is less than 2.8, the score is 3. And if after assessing each parameter, we are calculating the score or the points of each patient, then we are classifying them into different categories: class A, class B, class C, etc. So if it is 5 to 6 points, that is less severe case or least severe case, that is 85% survival rate. If the point is 7 to 9 point, if the patient have 7 to 9 point, they will belongs to class B. Their survival rate is 57%. Next is the class C. Class C got 10 to 15 points total. So they are having severe liver disease. Okay, so their survival rate is only 35%. So that is the child Pugh. The main uses of child Pugh score is assess the prognosis of liver disease, namely cirrhosis and chronic liver disease. And next usage is it will predict the mortality during surgery. So this child Pugh score, it can be assess or predict the mortality during surgery. It also used to determine prognosis as well as the required strength of treatment. And it also used for assessing the need of liver transplantation or necessity of liver transplantation. That's why we are using Charles Pugh score in liver disease.